pillar procedure has been developed in the last several years by a company called Medtronic. It is designed to address a very common problem in both men and women called snoring. I'm sure most of us know someone or maybe live with someone who snores, and for most of the time snoring is caused by several factors, one of which can be extra or redundant soft tissue in the back of our throat called the soft palate. That's the part of our throat, if you look in the mirror, it has the little ball in the back called the uvula. That is called the soft palate. Oftentimes, if there is extra tissue in that area, as we lay down and fall asleep, our musculature relaxes, and as air flows as we breathe, that tissue begins to vibrate. That vibrating noise is called snoring. There are also other reasons why people snore, some of which are related to some structural dysfunction in their nasal passages, and this has to be evaluated on a patient-by-patient basis. The Pillar procedure was developed to address snoring, which is caused by the soft palate redundancy. It involves placing very tiny implants, which are about ½ an inch long, made out of polyester, into the soft palate. Over time, these micro implants stimulate the body to develop a response or some scar tissue in that area. As the scar tissue forms, the soft palate becomes firmer, and as we sleep, it vibrates less. The procedure is done in the office. It takes about 20 minutes. It can be done, as most people do it, during their lunch hour. It can be done either under local anesthesia or more comfortably under sedation. And recovery time is approximately a day at most, for which some over-the-counter pain medication is given. Some patients have complained of a little sore throat that lasts a day or two, but for the most part, complications are very, very minimal, and recovery time is also very minimal. On average, the pillar procedure or the implants that are placed in your soft palate take at least 3 months or 8 to 12 weeks to scar enough to where you'll see significant results. There are some patients which require placement of additional implants after some time has been allowed for the initial implants to heal. All patients are first evaluated whether they are good candidates for the procedure. If they decide to have the procedure done, they are reevaluated again at 8 weeks, at 12 weeks, and at 16 weeks. After 16 weeks, at least 80 to 85% of patients have had very successful results, and for the small group of patients that have not had the results that they may be seeking, additional implants can be placed to cause the soft palate to be slightly stiffer or firmer and achieve the results that they're looking for.